Good evening, everyone. Welcome to our session. Welcome to our webinar on Humanity in the Digital Age, Counseling Careers and Tech Impact. As many of you know, counseling is a vital profession dedicated to supporting individuals in managing life's challenges, enhancing mental well-being, and fostering personal growth. In our rapidly changing digital age, our field is undergoing significant transformations. Technology is creating new opportunities for us to connect with clients, offer innovative therapeutic solutions, and expand our reach beyond traditional settings. Today, we will delve into the core principles of counseling, examine the evolving career landscape, and explore how digital tools are enhancing the effectiveness and accessibility of mental health services. We are also excited to introduce Amrita's new PG Diploma in Counseling Psychology. This program is designed to equip you with the skills and knowledge needed to thrive in this dynamic field. You will benefit from a comprehensive curriculum that covers both traditional counseling techniques and latest advancements in digital mental health. Thank you for joining us. We are eager to share insights into the future of counseling and the exciting possibilities brought forth by technological advancement, as well as the opportunities offered by our new course. So today we have three major personalities from our counseling field as our panelists. I'm very happy to introduce our panelists to you all. Dr. Frey is a professor at Amrita Vishwavidyapitham, Amritapuri campus, where she conducts research, teaches, guides students, and leads the mental health project. She holds a doctoral degree in clinical psychology. She completed a full-time pre-doctoral internship, followed by a postdoctoral fellowship, both at Harvard Medical School in the US. She is committed to supporting mental health and well-being among children, youth, and adults through developing research-supported programs. She was assigned to take the lead on a mental health helpline during the pandemic, a UNICEF project, and a project to reduce suicides and depressions among a large military group in India. These programs help to decrease mental distress and mental disorders and cultivate mental strength, happiness, and noble values for healthy and successful living. Dr. Malini's greatest mentor is a Mother Amrita Devi, also called Amma, who she views as her guiding light and inspiration. She also has been very influenced by Paramhamsa Yohananda, St. Francis, and Swami Vivekananda. Thank you for joining us, Malini. I regret to inform you that due to some personal challenges, Dr. Preetha Menon couldn't join us today. However, we are very fortunate to have Ms. Bindu Jan stepping in on short notice. We extend our heartfelt thanks to her for her immediate assistance. It is with great pleasure that I introduce Ms. Bindu Jan to you all. Ms. Bindu Jan is an accomplished assistant professor and head of the department in the Department of Psychology at St. Teresa College, Ernakulam. With over 18 years of experience teaching at the graduate and postgraduate levels, she has earned a master's in psychology from Nagpur University and a bachelor's degree in psychology from Union Christian College, Alua, along with a Bachelor of Education in Social Sciences from MG University. Currently pursuing her PhD in psychology from Amrita University, Ms. John is an AMA accredited management teacher in human resource management. Her teaching career includes roles as assistant professor at Saint Kitts Institute of Management, Kottayam, and ICFA at Kerala. Ms. John is a proficient soft skill trainer conducting sessions on topics such as interpersonal relationships, professional grooming, emotional intelligence, and more. Her expertise in counseling is evidenced by her active involvement in the Family Counseling Center, Kerala High Court, and the Victims' Rights Center, where she offers counseling and mentoring for women prisoners. She has also collaborated with Sagi One Stop Center at the Women and Child Development Department to organize public awareness drives on preventing violence against women. Her research interests span positive psychology, building psychological capital, positive organizational behavior, and human resource development. Ms. John completed her schooling in Dubai, UAE, and hails from Thiruvalla, Pathanamthitta. Thank you for joining us, ma'am.
Thank you. Thank you for the invite.
Dr. Divya Sundaram is an accomplished assistant professor and program coordinator of psychology at Christ, Deemed to be University, Bangalore, with a PhD in counseling psychology from Avnashlingam Institute for Home Science and Higher Education for Women. With extensive experience in teaching, psychological assessment, counseling, and research. She has previously held academic positions at Sri Krishna Aditya College of Arts and Science, Sri Shankarlal Sundarbai Sashum Jain College from Women, and Avinashringam University. Dr. Sundaram has guided numerous theses, published several research papers, and presented at national and international conferences. Her clinical internships span various renowned institutions, and she has completed specialized training in art therapy, holistic mental health, and multiple psychotherapeutic techniques. A dedicated professional, she actively contributes to academic and community services, including organizing workshops and guest lectures on crucial psychological topics. Her diverse skills and dedication make her a valuable asset to the webinar on humanity in the digital age, counseling careers and tech impact. Thank you for joining us, Ms. Divya.
Thank you for the invite.
So we are directly entering into our panel discussion. I invite Dr. Malini to share her opinion on our topic. Dr. Malini, you are on the stage.
Oh, thank you. Are you able to hear me all right?
Yes, ma'am.
Okay. So in a general way, the topic of technology and counseling it's very relevant. Technology is here. It's not going to go away, certainly not anytime soon. And my own experience, my own perspective, it's been a very crucial tool to help many people who might otherwise have been helped. On the other hand, there are really a number of shortcomings or negatives that can occur if we're not careful with how we use it. I can say examples of how technology and counseling has worked is really through COVID-19, when people could not leave their homes or they lived in remote areas where there was no access to treatment for any kind of mental distress. But what happened in COVID is, especially at least in Kerala, but really around the world, according to the literature, many people experienced enormous stress and distress. And some people really deteriorated psychologically, already had mental health issues that became much worse. Very soon after the lockdown in India, just as an example, our Chancellor Amma had us create a mental health helpline. Now, everyone was out of the school, so we had to do training with our masters in social work. We did training with them, a very specific training to help handle the calls, but we did that remotely through the internet. We also set up all kinds of we set up a triage system because of online availability, and dealt, of course, with all the callers through online mediums. So that was extremely helpful. I also know therapists who do a lot of online work, and for them, it's very good for them and also for the client when clients, again, don't have a way to get closer to meet somebody in person. So there are a lot of positives to having online or digital or technology involved in counseling. It reach many people we'd otherwise not reach, allow for us to get supervision from people from whom we might not have had it before. As I mentioned, and it can help with helpline services and also crisis intervention. But some of the negatives are there too. There is definitely an ethics consideration to take into account. And that involves being sure, of course, that we always keep very proper records of people with whom we work and that those are safe. And so we have to be careful of where we keep our records. Are people keeping them on an online platform or off the laptop or on the laptop? There are a lot of breaches that happen. People are mostly not aware of it, but breaches happen daily around the world from groups that are trying to get into our computers. So it's something we should take seriously. And it's also an issue. How do we deal with informed consent when we're online? How do we protect the health information? How do we protect our computers from virus and malware? Also, there's violations of confidentiality if we don't have sufficient technical safeguards. So we have to think of all these things. And different countries have different guidelines. It's quite strict in some countries. Here, not yet, but I think it will become that way. I just want to mention one other positive and negative. I mentioned that, of course, it's a positive because we can reach people we otherwise might not be able to reach. On the other hand, it's not always as easy to create a very good connection, a therapeutic alliance with someone online. It is done, it can be done, but there can be situations where it's not so easy. And it could have to do with just missing the subtle cues that people convey when you're sitting one on one with them, person to person. There's a big difference, definitely a big difference. And there are a lot of people also who pose as therapists who are not really therapists or counselors. And that can lead to problems for the whole field because those who are supposedly being helped aren't really helped in the long run. And they could misunderstand that and spread that around as being representative of the field altogether. But overall, I have to say, it's really been something that's been very necessary. It is necessary at this point. I'll just mention one more thing. I know we also have done, at least from Amrita, we had to do a very large mental health training with a large group of people during COVID. And we had to do the initial part of that again online. It was challenging. It was very challenging to connect with them. Eventually, we were able to, and it was a very successful program. We could not have done that without technology. So I think it's essential. I think it's helped us reach more people more easily. There are many advantages, but we must be aware of the potential disadvantages. I'll stop there because my colleagues will certainly want to add to this.
Dr. Malini Ma, thank you so much for setting us the stage for a beautiful discussion. You covered all the problems and all the advantages, both in counseling and also the digital technology. Now the floor is open to Ms. Bindu Jan.
Thank you, Dr. Malini, and thank you, Rajalakshmi. Am I audible? Hello?
Yes, ma'am. Yes, ma'am. Yes.
Yeah. Okay. I'll just add on to Dr. Malini, what she said. I do counseling for women prisoners and also in the family court. And I'll just cite an example of why this online counseling or digital counseling is a need. Like what Dr. Malini said, we cannot fight technology. So there's this case which is quite famous. It is there in the newspapers. It is a case that has touched me very deeply. So I often talk about it because I feel that, when we could have done something, nothing was done. So it's a case of this girl who is 21 years old. I met her in the prison in Thrissur, Viyur. And she is in jail for brutally murdering her sister, her twin sister. So when I checked the background of her case, during the pandemic, she was on treatment in a private mental health center in Ernakulam. And during the pandemic, she was denied admission. She's a dropout. She studied degree, her undergraduate for 2 years, and then she dropped out. And that kind of went unnoticed by the teachers and they, of course, the authorities. And then she was in her house and she was becoming violent and she was taken to a mental health facility. And she was on medication there. And during the pandemic, she was denied admission because she was COVID positive. So they told her parents to take her back home and to bring her after her COVID, after she is normalized. And the parents couldn't, they're from a very poor family, economically poor. And they brought her home and they tied her up. They kept her tied up inside because they couldn't handle her violent behavior. And for 2-3 days, this girl was chained up. And the third or the fourth day, her parents went out to buy medicines. She kind of convinced her twin sister that she needs to untie her. And the sister untied her. They both had a scuffle. It became a fight. It became violent. And this girl, she brutally stabbed her sister and then burnt her to death. And she absconded from there. She spent 24 hours on the street and then she checked into a shelter home. And from there, the police nabbed her and she is in prison. And if you talk to her, she displays all the classic symptoms of a serious mental health disorder, and she is languishing in prison. And recently I heard that she's got bail and she's inside her house and her condition is deteriorating. So for a student, for a girl who is 21 years old, who was denied permission to a mental health facility because of COVID pandemic, maybe if somebody had stepped in, or maybe if she had some access to an online platform, probably, her plight. So she's just one among millions of cases that we see around us. And sometimes, and during these kind of situations, we do need to accept that online and digital counseling is a part of our life, because if you take the statistics also, if you talk about the NIMHANS report of 15-16, it says that the mental health illnesses are rising in India, and most of our population is suffering from some kind of mental disease, and there is a treatment gap. There is a shortage. If you see the statistics, we have maybe 0.75 psychiatrists per lakh population. If you talk about psychologists, it's 0.07. And in Kerala, we have the highest, it's 0.06 per lakh population. So there is a huge treatment gap. And most of the time, the treatment is available in metros or in urban cities, and it is expensive, and people sometimes have to travel far. Then there is a stigma of going to a hospital. I get calls from relatives and all. They say, is there a place where we can go where we will not be seen, where nobody knows us, where we can have our privacy? Because they're still afraid of the stigma. And many don't have access to this appropriate care. Many don't want to go and get a treatment. So even while I was growing up, while I was in school and in college, if we had some issues, we would just cry it off. I don't think I've ever gone searching for a psychologist. But now we have mental health professionals, but very short in number, and the accessibility is also very poor. That is that there is a huge treatment gap. It's more than 60%. That is it's a huge number. And another thing is, it is the Ministry of Health and Family Welfare that runs the National Mental Health Services, and the budget allocation to that is very less. It's even less than 1% is allocated. And on top of that, the funds are not utilized by the states. That is the most tragic part, is that the states are not utilizing this meager fund that is given by the central government. And even though it is less than 1% of the country's total budget, our state has actually returned by saying that it is underutilized. So it is after the pandemic that we have this telemanus that is introduced by the central government. And it is a district mental health services that focus on the mental health of these particular states. And during the pandemic, they had a telephone checkup, this telemanus thing itself. They had recruited our students, our graduate students, just to take wellness calls to these COVID patients. They had a huge database of the people who are coming to the government health facilities for the COVID treatment, and they would make our students do these wellness checks. And it made a small difference. So definitely we need to think about online and digital counseling. But at the same time, when you talk of this, adding to what Dr. Malini said, the negatives are there, the digital, the privacy, the ethics, the issues are there. But when you talk of digital counseling, we also need to consider, if you're making an app or a web application, we need to consider the people who are physically disabled. We need to consider, the intellectual challenges, people with ADHD, whether they can, the success of any digital counseling depends upon how we are, how we immerse ourselves in it. So this is the same concept that is taken by the video game, the people who design the video games. You start playing and then you're hooked, you cannot come out of it. They have a lot of things that make you hooked. So in the same way, even this digital counseling, it should be of benefit not just to the people who are, like having certain mental issues, but also we must consider people who have, the deaf, the blind, and other physical ailments and intellectual problems. for them to maneuver into this online technology and to take advantage of that and to keep coming back to that. Because many times you just can just switch it off. You don't have to go back. So that is the problem. That happens even in the physical therapy also. Like if you go, you just decide not to show up at the clinic for your. So definitely we need to consider the ethical issues, the how the privacy of the person who is creating the web applications, the mobile applications, the confidentiality, all these things need to be considered. And I think I think they have a code of ethics for digital counseling and for their online counseling services, which we don't have. We don't have anything of that sort. So in a country where there is a lot of crime related to online, and we need to have a code of ethics that is, by the government that comes, which makes it very clear there should be stipulations. Okay, so I'll stop here and I'll give it to the next person. Thank you.
Thank you, ma'am. Thank you so much for introducing an interesting case study and bringing in a lot of concepts like legal regulations and ethical concerns of digital counseling. Thank you so much. Now the floor is over to Dr. Divya Sundaram.
Thank you, Dr. Rajlakshmi. And thank you to Dr. Malini and Ms. Bindu for beautifully bringing to light what are the challenges that we are facing right now. So though we do focus a lot about the challenges, I would say that it is completely a negligible amount to the amount of positive effect that we're trying to make with, say, our intervention that we're able to offer through the online mode. So keeping the present generation in mind, there are numerous researches which has been done looking into how the present generation is different from the past generations. Like we as say human beings, we are social in nature and we do have the need for social engagement, be it verbal or be it physical, with other individuals. And say the physical presence of an individual by itself provides the opportunity for the individual to vent out. Right? So we do see that in the present generation with the competition that's around and the fast moving lifestyles that we have, there is a huge gap in the presence, the human presence of, support that we are able to expect to others, which I feel is is at large bridged by this online mode of, offering the services or say offering support to the individuals. So with the present generation, we see that there is, say, a lot of social anxiety that these individuals go through, especially when they have to interact with an individual face to face. So added to it becomes the stigma that is attached to the mental health, or again, the hesitation that these individuals have when we're going to be looking at counseling. Say, whenever we're looking at, say, physical health, we are always open to look at we are open to approach a physical, practitioner, health practitioner. But that's not the case with a mental health practitioner. It is generally, say, internalized by the individual in such a way that they have been a failure because of which they were not being able to manage themselves. And again, the family also tries to put the blame on this individual for being in this state, which, like all people who are into the field of psychology would know that, it is not completely because of the responsibility that the individual is supposed to take. But again, keeping in mind that it is alterable, we need to be encouraging more individuals to at least opt for counseling through the online mode, or say other technology based mode by the use of app assistant, say activities, or say we do see options where even email counseling is becoming, a very, say, prospective area. So being an assistant professor at Christ University, there's a recent initiative that we had made in order to overcome this particular challenge, wherein we have opened the floor for email counseling as well as letter-based counseling, wherein students are allowed to write to us and we from the department respond back to the letters that they have given us, so that they overcome the initial hesitation of wanting to talk on the face-to-face mode. So saying all of this, I would like to give a new tangent to looking at mental health. I think this is a lesson that we try to learn from the COVID pandemic and the COVID related times. We had so many, say, preachings happening about, or say, so many implementations about how prevention is important. because we were having a huge deficit of the resources that we had when we had to admit people or when we had to give them oxygen support, etc. So the importance of prevention and the importance of safeguarding yourself before we reach the state of having a illness was insisted a lot upon, which I would like to see how it has to be adapted to the mental health setting. So at large, we see that there are certain skill sets which are, say, lagging in people in the present generation. So keeping in mind the collectivistic, societal setup that we were having in India in the past, say, decades, right now we're moving more and more towards, say, more of nuclear families or more of, couple with pet parenting and things like that. The amount of social support that is there is decreasing, which again brings to surface the need for prevention and also some sort of education, which we would better call it a psycho-education on how they are going to be, say, managing themselves, or how they are going to be building positive psychological concepts like aspects like resilience, or how they're going to become more perseverant in whatever efforts they try to put in. So again, trying to collaborate this idea of prevention with the public health model that we've been following, especially in India, in the case of, say, cholera or AIDS or, say, mumps and things like that. So following the public health perspective, or say the public health model, is going to be something that is of a promising return to all the mental health professionals, wherein we start sensitizing people on healthy mental health practices, which will be, say, shaping their behavior in such a way, or say, which will be educating them in a way wherein they would acquire ways and means of taking care of their own mental health, challenges in the initial stages itself. Right? So whenever we look into the case history of our clients, we see a very clear pattern wherein they've had, say, an event which has been a predisposing factor, and then we move to the precipitating factor, and how then there is a triggering event which is going to be causing the sudden outset of the symptoms. So alongside, we also look at the protective factors. So keeping these factors in mind, when we start educating the individuals on ways in which they could safeguard themselves, ways in which they could prepare themselves better on the mental health realm. So where they can rely on their protecting factors more in order to, build their, say, fort around themselves more stronger. That could be a way in which we try to avoid the prevalence, or say avoid the occurrence of mental health conditions to a greater level. So I would say that technology is going to be helpful to us a lot in this particular perspective, wherein, say, the present trend being towards Instagram Reels or YouTube Shorts, or putting posters, WhatsApp status messages, or, say, Facebook stories and things like that. These could be used as promising platforms wherein we try to psycho-educate the followers, wherein we try to psycho-educate lay people about what could be handy ways by which they manage themselves, handy ways by which they look out for support or they look out for help at the initial stages of the occurrence of the symptoms by itself. So having said this, I hand it over back to Dr. Rajalakshmi for proceeding further.
Thank you, Dr. Divya Sundaram. I'm very happy to see the way you have introduced the systemic perspectives into the discussion, and you have already touched upon the required tools and the required methodologies to handle the problems and challenges we are going to face when it comes to digital counseling. Thanks a lot. Yeah. Now, now I am opening the floor for the discussion of all our panelists. I would like to start from the scratch. We are living in a country like India, and where counseling itself is not being well taken by all people. But the problems after COVID-19, as all our panelists mentioned, only counseling is not going to help. So, from normal counseling to digital counseling, how are we going to make people to come? The uneducated crowd, how are we going to get them into the flow? So I am opening the floor to all panelists on this question. Please discuss your views, share your views, and also discuss among yourself. Now the floor is open for all three of you. Thank you.
I really don't have an immediate answer to your question, but I will say that one thing that's extremely important is training people well. If we're talking about a mental health counselor, like the 1 year certificate course we're talking about, that's wonderful, but it will have limited application. There's a certain kind of person they'll be able to work with some confidence and some real ability. But then you look at master's programs in counseling or in psychotherapy and doctoral programs, those things can all be extremely helpful as people are drawn to them. And I think more people are drawn to them now. But I really want to emphasize something that Dr. Divya said, because this is something I feel so strongly about too. And that is we need to do so much more just training about prevention, how to have good mental health. Um, Something else I was going to say about that, but it just slipped my mind. So I'll just start with that. I think the counseling program that is going to happen at Amrita starting in August is something very good for people, and I think that will draw more and more people. I think as we have training centers available, people will come. I just want to add one thing too that I think both of our other panelists spoke about the huge treatment gaps in India. But what's alarming to me is that these treatment gaps are equally, sometimes more wide in other countries. Take Singapore, a very wealthy country, enormous treatment gaps into the 80, 70, 90 percentile. USA has huge treatment gaps with certain populations, especially children. So this problem is really global. And I believe that COVID really catapulted it forward. It did two things. It made things worse for people psychologically, and two, it did something very good. It made us much more aware of what we need to do. We need to do much more than what we've doing. We can't think that everyone can go and see a person privately. And I think Dr. Divya said as well, both of our panelists, we need to have technology for people who are too far away. And we must educate families, people with mental illness. I think sometimes about the kids walking around in the college. There's a certain percentage who will be walking around with severe depression or with voices in their head or delusional thinking, and they're just trying their best to hide it. Because, as Dr. Bindu spoke about, or Miss Bindu, soon to be doctor, I believe, spoke about the stigma. People still have stigma. So somehow we need to normalize anything with the word mental. Mental is not a bad name. It's about everything that happens in our mind, the positive, the negative, the creativity. Everything starts from a mental perspective. We need to capitalize somehow on normalizing our talking openly about what is a mental disorder, what is mental distress, what are the differences, and how can we help people address these earlier. Earlier is better. Prevention is best. But of course, we'll have all stages at all times, probably. Thank you.
Dr. Malini, thank you for that. I just want to add on that I am again reiterating that we are going into the digital platform and digital counseling is important. And as Dr. Divya pointed out, that our youngsters are all, their phones are like an appendage for them. But at the same time, when you talk about digital tools and technology, it will benefit the youngsters and the coming generations. But what about the older people in our homes? The people who are old, they are not very familiar with technology. And as Dr. Rajalakshmi said, the rural areas. So it's a question of designing whatever the ease of use, the language, because we are multicultural, we are multilingual. So if we are accessing a therapist, is there a cultural barrier between me and a counselor who is from another state? So these are some of the things that we really need to work on. This is something that that needs discussion. We need policies on this. There are a lot of people I have come across who, after their retirement, they would have studied BSc Maths or Physics or Science or Geography or whatever. And after their retirement, after their jobs, they want to do counseling. without a basic knowledge of what is the grounding principles of counseling and psychology, and then they think that they can do an online diploma course in counseling. And then recently I met an MBA graduate, and I asked her, she's an MBA, and I asked her, what do you do? And she said she's a wellness therapist. And I said, what do you mean by that? And she said, I have my clinic where I do counseling. So these kind of people are there online also. So that kind of awareness, there should be a proper licensing for the people who are doing counseling. And there should be a lot of rigor when you're making these mobile applications. Like I said, it's even along with our youngsters and the normal people, we need to focus on the vulnerable categories also. We need to keep the language in mind, the culture in mind. And this is not something that can be done overnight. Because in a country where we have 0.07 psychologists per lakh population, we need to really work on the statistics, and we need to work on policies, and we need to work on the web applications, and we have to have the laws in place. Thank you.
Okay. So again, my co-panelists have made my job a bit tougher, I guess. Almost, I think a lot of points have been covered by them, but then I would like to add on something. Like basic human tendency always pushes us towards believing what we see, right? So I would say we should be making use of technology for at least giving people smaller reinforcements if we're going to be following the principles of token economy, right? So when we start, say, psycho-educating them, when we start making smaller reels, which is going to educate them on the possibility of change, then those would be aspects which would at least leave them with a promise that yes, change is possible if I am going to be taking the right support and the right effort, right? So technology is something I feel which shouldn't be completely avoided or completely to be shifted into, to look at with complete reliance, but maybe integrating the technological as well as the non-technological skills that we have is going to be something of importance for us to look into, right? So when we start strategizing well, when we start collaborating all of our ideas towards how to make mental health more accessible and how to make mental health services more appealing to people, we again are moving towards more of experiential therapies these days, where we want them to have therapeutic strategies more handy for them to do it at their own spaces rather than coming and sitting in the clinic with us all the time. So keeping all this in mind, if you're going to be using technology in the right way to create more awareness, to motivate people more to approach mental health professionals rather than say shying away from the system of counseling, then that would be I would say maybe a paradigm shift that we can bring, at least in our cultural setting or say our community, our society, towards how we make mental health more acceptable, more, bring the significance out about people realizing on how mental health is important and what's the value that it's going to be adding on their performance levels or their efficiency levels. Over to you, Raj Lakshmi.
Okay, thank you. What not? We have got different viewpoints about how to see the country's perspectives, how to be a clinical psychologist and collect the symptoms, and also the policies, licenses, and now Dr. Divya Sundaram has talked about the techniques. So, as of now, we have been talking about what are all required to bring counseling into our country, both in digital space and in regular space. As a curious, normal layman, I'm going to ask you all a question. Whether I'm coming to you people, counselors, online or offline, what will you do with me?
Please notice that she turned off already. Dr. Rajalakshmi, that's a little bit vague. A little more hint for us. It's a good question. A little more hint.
why I think what she meant is that when she comes online, what are we going to do with her initially? So it begins with your diagnosis, and before that, it begins with your information that you're giving us. Isn't it? So you're concerned, you should be concerned about the information that you're giving us and how that information is being used by us. Is it going to be kept confidential? Do I only know it? Do my software team who created the technology, are they getting that information? And informed consent, then I need to see you, because sometimes it happens that you could be underage, or you could have somebody else, an imposter, trying to figure out things. So she's talking about how secure is the counseling process, right? So Malini ma'am.
I'm not sure if it's about that, but I think everything you just said was very, very important. But especially that last part, people do um, yeah, act as imposters when they go online for treatment, because they want to see if, or some pretend that they want to talk about their friend who is suicidal and how you can help them when it's really them. And I have to say that that's one area where people really need very good treatment. I mean, good training to be able to deal with online suicidality, because there really are serious steps that need to be taken. But just to add to what you were saying, Ms. Bindu, of course, Dr. Rajalakshmi, we have to understand also, in addition to what was already said, well, what made you want to call today? Anything in particular? I think we would start in a very kind of general way, given that you're coming in with no clear directive that you're sharing initially, no clear direction, no clear purpose. But clearly there's a reason, and so we have to start just asking some gentle questions without probing too deep too soon, and try to make some little connection with you. What made you call, and things like that. But Dr. Divya, I'm sure you want to add to this.
I completely agree with Dr. Malini on her views of how, we give them hope in the first place, right? For any person who's going through challenges with their mental health, I would say they are completely lost. They are not, in a space where they can ground themselves. They're not in a space where they can put it in words to another individual on what is it they are going through. They themselves are confused. They themselves are lost in their thoughts. They're lost in their emotions. They feel so baseless and supportless. So when they're going to be approaching a mental health therapist, be it online or offline, the first message that we try to convey to them is, yes, I do understand the language that you're speaking. Yes, there are people similar to you who are going through experiences like these, and it's not just you who's alone, right? We give them the hope that, yes, you are being listened to, you are going to be supported through this, and just that can happen to be the change that they expect is what I have seen. Like, I've been practicing both through online medium, especially during COVID, and offline counseling, where I've seen in my clients, the kind of emotional bliss that they go through when you're ready to acknowledge that, yes, I do accept that you're going through symptoms. I am not saying that you're faking it, right? So that by itself brings a change. So, like the theories of professional counseling say, the therapist by itself becomes the tool for change here. So that is something that we have invested in our clients. So as a mental health professional, I would proudly say, and again, for the future aspirants who are going to be coming here in the field of psychology and mental health, I would urge all of you to be proud about the initiatives that you're ready to take in making the experiences of another individual more positive and pleasant. Right? Yeah. Thank you, Dr. Rajalakshmi, for asking us such a beautiful question so that we could express something which is very close to heart.
Thank you. Thank you so much, panelists. This question is the question of many people who want to approach counseling, who approach counseling also. As a counselor, I could hear this question from their body language, from their mind. Sometimes they verbally acknowledge this question also. So I wanted your different viewpoints on this. Now we have 10 minutes more. So I would like to ask a question on, we understand the digital technology is required. We understand, and you people talked about how in a country like India, where there are a lot of legal aspects are required, licensure procedures or are required, how are we going to bridge the gaps? Though Dr. Divya Sundaram and some of you have already touched upon, can you give us a very nutshell point of view? What are we going to do in this area? Digital counseling. What are we going to do? How are we going to make people to take up this technology? What are essential?
Uh, Dr. Rajalakshmi, is it okay if we go out of turn, or are we following the pattern? If my co-panelist would accept it.
Yes.
Please go ahead, Dr.
Yeah,
Divya.
thank you. Yeah, thank you. So, of course, that we do see that there is a gap. There are certain measures that we have to urgently take with, keeping in mind the speed with which we are progressing in the numbers of people who are, you know, uh, becoming encountered, or say who are pushed to have psychological conditions because of lack of support or because of the competitiveness that the world is bringing. I would say speaking about it more would be the key. So the more we speak about it, the more we normalize having mental health concerns. Of course, we see that there is a particular style, or there's a particular trend on the social media where calling ourselves to be depressed or calling ourselves to be in a manic state has become a style statement. We need to bring a difference in how this is not a style statement, but this is something that is to be normalized and brought to discussion more frequently. So earlier days, I would say relationship issues was something which was going through a similar kind of a crisis, where we never had, like say, our previous generations open to talk about relationship issues. And we see that the present generation is suffering because of that, not knowing how to manage their relationships. So we shouldn't be doing the same mistake with mental health conditions, is what I would say. So the more we speak about it, the more we educate people, the more we say train them to handle things well, they would not only be able to help themselves, but obviously also support a maybe a paining friend who requires support. They could be giving them the right direction or the right track that they need to be taking with enough information. So the lack of information is again a huge challenge that we have as of now. So in the Indian context, with not much of indigenization happening, we see that even till date, most of our courses try to follow, Western theories and Western therapies and Western author textbooks. So bridging this gap in communication, trying to indigenize whatever ideas we have, helping an Indian understand mental health in the Indian context would be something which would say appeal a lot to the lay people. So I would like to hear from my co-panelists on what their views could be here.
Dr. Malini, will you be saying something?
Would you like to go first, madam?
Yeah.
It makes no difference to me. Sure, I'll go after you.
Okay. So to answer Rajlakshmi's question, what are we going to do? So I'll just put it in a nutshell. One is if we are going to do digital counseling, we need to have the technical proficiency for that. So the counselors need to be familiar with the digital platforms, and counselors should also have the confidence to do this online counseling, because many people shy from the screen. I mean, they have a screen shyness kind of a thing. And digital literacy is important for counselors, and also communication skills. That is, it's different from face to face. When the person is sitting right in front of you and the person is on a screen, the counselor should have excellent, effective online communication skills. And also, understand the ethical part of it and comply with the legal laws and policies. So how are we going to spread this is, I would suggest is that one is there should be ongoing trainings and workshops and webinars where counselors are regularly participating in digital counseling skills. That is, you need to build your digital counseling skills. You need to be aware of cybersecurity issues and also the latest digital platforms that are available for counseling. And I think we should also be bringing in specialized courses or certifications in telehealth and digital counseling, and also probably tie up with the other other medical associations like IMA, the medical professions or our psychological associations, and kind of spread the word about digital counseling being available. So professional associations can play a major role in spreading the word. And networking is an important way in which we can pass the message. And we need to be having all counselors, when you're doing this kind of digital counseling, we also need to be supervised, and we need to build support groups also, so taking part in support groups. And I think our curriculum needs to include digital counseling as a part of the academic curriculum, so that the students are aware that how they can go about doing this. So practical experience should also be provided for counselors on digital counseling. Right now the practicals it happens in the field, but I think this also should be included in the academic curriculum. Yeah, thank you.
Well, I salute both Dr. Divya and Ms. Bindu for really wonderful ideas. Some of mine are actually similar. I feel also, as you said, Bindu, that we need to bring our professional groups, I think, together. I think clinical psychologists, counseling psychologists, if we could somehow have some way of connecting and just brainstorming together of how we can promote mental wellness, mental health in a larger scalable way. I think it would be wonderful if we could do that. But I also think, in addition to not just teaching psychological principles, but also I feel that the world has deteriorated tremendously in embracing higher universal principles and values. Much of this comes from what Dr. Divya said, really all of this comes from Vedanta or the Vedas, and including maybe especially Vedanta. Universal principles that really teach us how to live in a healthy way, how to understand and manage the mind. I saw that going away as I was growing up. Prayers in schools were outlawed, and we just don't see the compassion that is necessary for people to have healthy lives and a healthy world. In fact, what's happening in the world today, I have never seen it like this before. I think I've been around a little bit longer maybe than some of you, but it's really quite tragic. On the other hand, it's such an amazing time to be on planet Earth and to have great leaders in the world who can help us really try to band together and go forward and do some good and spread that so that others pick it up. I think we have to look at different levels of people who can help on a one-on-one level, on a group level, on a community level, where we can teach people, like in the certificate course, some very basic things. There's a limit, as I think the other panelists said, to what they really can do. We should not put people without a deep knowledge of severe mental health issues in that kind of situation, because more harm can be done than good. But there's a lot of good that can be done, even as training people to be a good school counselor. We had a student who did her research on, she interviewed many school counselors about their work with the kids. Almost universally, they said they really didn't know what they were doing. So our training needs to be clear. It needs to be very organized. It needs to give them information and knowledge and skills that can help to the degree that they can help right then and right there. And also the knowledge of how to then help someone go to someone who has higher level training if that is needed. So some triage system for those who might need more than what maybe a school counselor can offer. There's a lot more that I could say, but I know we're running out of time, so I'll be quiet. Thank you.
Thank you, dear panelist. You have brought in a lot of aspects as nutshell, and summarizing it in a nutshell would be harder for me also. So I would touch the broader aspects. As for this 1 hour discussion, we can identify that India requires a lot of awareness about what is counseling first, the basic counseling, and what is not expected to be, and also the awareness about counseling is actually a tool. Coming to a counselor is not a problem. Coming to a counselor is a self-help you can offer to yourself. And when it comes to digital technology, first step, the A step has to be we need to be open and take the tool to easy ourselves. And that is the first step India has to do. And when it comes to the institutions, as pointed out by our panelist, we need to bring in lot of procedures, legal aspects, licensure aspects, and things. Yes, participants then definitely ask questions. So I'll finish my summary. Yeah. And when it comes to the digital part, India is still in the downtrodden level when it comes to digital part. When it comes to other countries, we still identify only minimal amount of apps and minimal amount of web-based interfaces that can provide counseling in digital platforms. In other countries also, digital technologies like, let's say, XR technology, LLM methods, or any interfaces, they are in the basic structural level. So that has to be expanded by the other countries. And we, as Indian country, we need to develop both the awareness about basic counseling and the digital methods that is applicable to both rural and urban India. So I'll stop my nutshell summary, and owing to the time, we can and audience can ask 2 questions. We have time for only 2 questions. So please post your questions in the chat. We have time for 2 questions. So while we get the questions, I really thank all the panelists. Amidst your busy schedule, yeah, you people came and you gave your beautiful views on this.
Thank you for having us and for organizing the webinar.
Thank you, ma'am. Thank you.
We're glad that we were able to share our views with the upcoming generation of mental health professionals.
Looks like the audience doesn't have a question.
Yeah.
Rajalakshmi ma'am, there's one question in the Q&A box.
Yes.
It says, how
Yeah.
important is the internet connection during a counseling session, both from the client side and the psychologist side?
Okay. Would anybody like to answer this question? Any of the panelists?
Yeah, internet connection is important, and you need to have a backup plan in case the internet connection fails. And it's
Okay. There is another question. What are the tools we are using for assessment before counseling? That is another question. Any of you would like to take?
Okay, so something that I want the upcoming psychologists to be knowing. In the 80s or say in the 90s, we were having a trend where we used assessments for every aspect to measure the, level or the severity of the client. But the present day, if you look at the third wave therapies that we've been using, we've moved towards more reality therapy, looking at the present, or looking at more of solution focused therapies, wherein I would say you giving assessments more than we seeing it as an extension in time, though it might be a huge advantage to us for collecting a lot of information about the baseline of the client in the present circumstances. not many clients are very welcoming of the idea of using assessments in the present day counseling setup. They want us to quickly go into how they can bring about change, or how they can see themselves take a positive thread across the way. So I would say, and it is also my personal view, that I would say use assessments when necessary. More than using of assessments, I would say the communication that you're going to be having with the client will add a lot of value to the counseling process. And as a counselor, you know the importance of asking questions which are appropriate. So when you can frame your questions appropriate to the particular client rather than relying on a standardized tool. So like I said, there's a lack of indigenization in resources. We also have a lack of indigenization in tools. And unfortunately, a few set of tools that is available in the Indian context, we see that the language is not very great. And we do see other, challenges that are present, which we have to accept some. So maybe looking at more situation specific, client specific, tailor-made questions rather than a standardized assessment would serve the purpose better, is my view.
I'll just
Thank
say
you
a
so
little
much for
bit.
your view.
I would just add a little bit, because I do actually will sometimes do assessments with people, but not lengthy assessments. After I speak with them first and let them share what's going on. And if I can cue in that there are some patterns, I'll do a very simple assessment to see the severity level of their suffering, because it gives me information of how to go forward. And they won't necessarily be able to quantify a level of severity, but sometimes simple assessments can do that. And I think while I'm on this, somebody asked about how they could avail the counseling course, that 1-year course, if they're from North India. And I should just say the course is taught in English. In Amrita University, all the courses are taught in English, so people can come from anywhere in the country.
Okay. Dr. Bindu, when it comes to your answer, the internet connection is lost, so we couldn't hear you fully. Would you like to say it again?
That's my point. When you're in counseling, the internet connection can go off like this. So you need to have a backup plan.
Did you
Every
plan it?
counselor
It
should
was
have a
perfect.
backup plan.
It's very perfect.
The
It's very
timing was perfect.
Yeah, it went well.
Yeah. So
I
there's
thought it was
definitely
my
an
connection.
No, it was my connection. Yes. So I was saying every counselor should be having a backup plan and to ensure that this process is not disrupted. See, for everything, there is a risk. When you do face-to-face counseling, there are risks that come along with it. Because I'll just say one more example of a patient I know. She's symptoms of hypersexuality, and she was taking counseling from a male psychiatrist, and because of the nature of her disorder or her illness, she was making sexual advances on the psychiatrist, and he kind of crossed the lines with her. So these kind of risks are there, where the professional relationships, the line gets blurry, or there can be a lot of risks even in the face-to-face, and an online also has its own risks. So one can be the internet disruptions, the privacy issues. So we need to be prepared for all of this, which is why I said there should be policies and laws in place, so that these kind of risks can be minimized and that people can actually benefit from these digital platforms. Yeah, thank you.
Right. So there is an apprehensive statement: without assessment, how can I do counseling? So for that, you are welcome to our course. We are offering PG Diploma Counseling Psychology in Amrita. You do come to our course. We will teach you how to do counseling without any assessments and with assessments also. And there is a statement like careers prospects of this program. Thank you so much for reminding me to introduce about the course also. So when it comes to PG Diploma course, we do offer placement services, and and you can start your private practice also. Thank you so much. Yeah.
See, one thing let me add on to the audience who's sitting here is that when it comes to mental health or mental health facilities, some people require medication and some people require therapy. Medication is not in therapy also. So where medication is important, there should be a diagnosis. So diagnosis is done with an assessment. That is an equally important part of counseling. So after the diagnosis, you know whether the person needs to be on medication or whether the person, because there are extreme severe cases of depression, of suicidal risk, or lots of issues are there which are not actually where talk doesn't help, where the person actually needs to take certain medicines. So both is important. So for a diagnostic perspective, there should be if medicine is required, medicine should be given. If it's counseling and talk therapy, that should be given. That's my take on it.
Dr.
But
Malini,
if
ma'am?
this is, well, I would only add to it that if it's someone with
Yes.
just basic counseling skills, that's going to be something that I think they need to refer a person like that to someone with higher level skills. And certainly everyone should have access to people that they can refer to, psychiatrists, like Dr. Bindu was saying, and also maybe other psychologists, people with higher level training. For people learning just basic counseling, they should refer someone like that on, I think. That's my personal opinion.
Great. The discussion is going very nicely, and
Dr.
we are getting
Rajlakshmi,
questions also. Yes. Yes.
I had like following the question of one of the participants on their career prospects. I just wanted to make a mention of how a PG diploma course is important in the present day standards. Like with the NEP in place, we know that the structure has changed so much that we have multiple entry and exits. And for a person who's aspiring to do a higher education in mental health, there are a lot of institutes which are demanding a 4-year undergraduate course for a master's registration rather than a 3-year course. But if we look at the NEP standards again, there is a huge, gap that happens to become a burden to the students, wherein they demand them to have a 75% marks on their exams and also a 75% attendance mark for them to be eligible to apply for the honors course itself, which would be the 4th year of the undergraduation course, let alone whether they clear the interview. All of that comes later. So even for them to be eligible to apply for an honors course, it becomes necessary for them to have a very high standard of score. So at least for these students who have slight gaps in their performance levels, a PG diploma course is like the saver for them. It's like the go-to option for them when they want to make themselves eligible for a master's degree. So when you've been say offered a BSc degree by your institution and not a BSc honors degree, you do not have any other option to save you from that particular fix that you are in, but to go for a PG diploma course, which would obviously enhance your employability, which will enhance your say readiness for master's admission, and again make a difference in your career, or say in your career path on your resume, on how you have an additional qualification as compared to the other counterparts or the other competitive partners that you might be finding in your own realm. Thank you.
Thank you so much, Dr. Thank you so much, Dr. Divya. You have added valuable points for why we need to opt this course. And I am giving the mic over to Dr. Malini. Please add your views.
I don't really have anything more to say. I really agree with what Dr. Divya said. I think it's wonderful we're offering this counseling psychology certificate course, and I think it will draw people to want to go to higher and higher levels of learning, and that will make a very positive difference in around the country.
Thank you. Thank you. Ms. Bindu John?
I think that's been covered. So the question has been covered. I mean, it's been answered.
Great. So that's what we did throughout the session. Thank you so much, the panelists, and the participants. We really wanted to talk more about counseling and digital technologies, but our time is limited. We will create more programs like this, and we will contact you soon. Thank you so much for participating. And panelists, thank you so much for making this program a very interesting and informative one. Thanks a lot.
Thank you.
Thank
Thank
you.
you for the
Thank you
invite.
to other panelists. Thank you also. Thank you, Bindu.
Yeah.
Thank you.
Thank you. Thank you,
all of
Malini
you.
ma'am. Thank you, Dr. Divya.
Thank you all for
And
the
everyone.
interesting
Thank
experience.
Thank you,
And
Dr. Rathalathan. Thank you all those who came to listen also. Thank you.
Yeah.
Namaskar.
Yes, yes. So, can we leave?
Yes, ma'am. Yes,
Dr.
please.
Raj?
Yes.
Yeah.
Thank you.
Okay.
Thank you.
Thank you.
Thank
Thank you.
Thanks a lot.